the common medical emergencies which can be encountered and which can be very frightening at home. So the emergencies can involve any of the system of the body, like our central nervous system, which is our brain and the spinal cord, the respiratory system, that is the breathing system, the heart or the cardiovascular system, the gastrointestinal system, renal system, which is kidney, urinary bladder, and there are other conditions which can present to emergency like poisonings, traumas. So what you need to do and what are the important things to remember. So how to identify a sick child. So identification of a sick child is a very important aspect, because once the child is brought to the medical facility well in advance, before irreversible things can happen, then timely intervention can be instituted and the outcome would be better. Like any child who is excessively sleepy, following a bout of illness like fever, cough, cold, loose motion, vomiting, like if he is excessively sleepy or lethargic or not feeding well or has not passed urine or is not able to interact with the parents or not aware of his own surroundings, is usually significant, and there could be an underlying serious problem. So these things has to be addressed. So these points needs to be remembered, like which will help in seeking medical advice at the earliest. Now when it comes to the brain, any child with brain problems can present with different signs and symptoms. Like as I said, a child who is excessively sleepy or not waking up or is responding only to pain, so again signifies that he is having a serious underlying problems like seizures, which are quite obvious, like abnormal body movements, which is usually frightening, for which the parents seek medical attention. So there are some other subtle signs which needs to be identified and which at times is quite difficult for layman or for the parents. There are symptoms like if a child is having fast breathing. So fast breathing for any child of any age group, if he is breathing at a rate of more than 60 times per minute, that again indicates there is underlying serious breathing problem. Or if a child who is breathing too slow, that is the breathing rate is very less, if it is anything less than 10, again it signifies a serious underlying problem of the respiratory system. A child who is appearing bluish colored limbs or blue colored lips, or having cold extremities, dusky appearance, again it indicates that the problem is with the blood circulation. Apart from that, the other problems with other systems, like any child who is having severe pain abdomen, which is associated with vomiting, loose motion, bloody stools, again has to be taken seriously. A child who has not passed urine, again it indicates an underlying serious problem involving your kidneys. So these are the common problems for which usually children lands up in the emergency. Apart from this, a child who had a head injury, a child who has fell from a height of more than 3 feet, and post fall, if the child has loss of consciousness or the child had seizures or there is 4 or more bouts of vomiting, always needs to be taken seriously, as this could be due to an underlying bleed in the brain. So these are the common problems which are usually encountered, and where the parents needs to be quite vigilant and seek medical attention at the earliest, so that timely intervention can not only save life but also prevent the lot of morbidity associated with these type of conditions. Thank you.